The PHE investigation into the way in which the virus targets people unequally and disproportionately has been put on the website. And this is a particularly timely publication because right across the world, people are angry about racial injustice. And I get that. Black lives matter. And I want to say this to everyone who works in the NHS and in social care. I value the contribution that you make, everybody equally. And I want to say it right across society too. I want to thank you, and I want you to know that our whole country cares about your well-being. And I value too those who come to our country to work in the NHS and in social care. And I love that this country is one of the most welcoming and tolerant and diverse. That goes for the whole country, and it goes especially for the health and care system. As I said in the House of Commons earlier, PHE's investigation found that age is the biggest risk factor for coronavirus. Next, gender. Living in a city is a risk, and being black or from a minority ethnic background is also a significant risk factor. There is much more work to do to understand what's driving these disparities and how the different risk factors interact. And we are absolutely determined to get to the bottom of this and find ways of closing that gap. I think this is an incredibly important area. I've been really struck by the clear difference in the proportion of people who are dying with COVID-19 from ethnic minority backgrounds, and I wanted to get to the bottom of it. So I asked Public Health England to do this work by the end of May. They've done that, but you're absolutely right that there's much more work that needs to be done, and this report shows that. So I've asked the Equalities Minister, Kemi Badenoch, to take this forward and to look into the causes and what further can be done.
There are still some questions. I mean, what we do show is that there's no simple, if you take, I mean, there's a lot more than just the ethnic differences in the report. There are differences to do with levels of deprivation and where people live and occupation and so on. And all these causes are the causes of health inequalities anyway. And actually what the report emphasises is the fact that what COVID-19 has done is to emphasise the existing health inequalities in the country. And it shows us again that we need to address those inequalities, whether they're to do with deprivation or to do with people's background.